And it's 2019.
Yes.
We are in Pula,
Yes.
in Croatia.
In Croatia. Yes, each year International Eye Association makes a conference with all kind of specialists in color.
Yes.
Psychological therapists, doctors, physicians, natural therapists, all people that have passion for the colors.
And from all over the world.
Yes.
35.
35 nationalities now today. It's incredible.
It is.
I think the color is the future in medicine. Yes, I think that.
It is. I totally agree.
I arrived to treat people with color. First of all, I am anesthesiologist. After that, I have a specialization in pain management. But when you see patient with pain, with chronic pain, the 70% of these people with pain, they had some childhood trauma. Then you have to treat the trauma in the childhood to be sure to have success in the treatment. Then I know different techniques. One of them is the auricular therapy. And as you know, Dr. Paul Noyer always talk about the psychic scare, psychological scare.
Yeah.
In the air.
The
you
toxic
remember?
scars.
Yes,
Yes.
okay. Then I make some observation about the fact to, at the same time, to ask to the patient, remember the event, the traumatic event, with an image. At the same time, we can treat in the earlobe this traumatic, yes. Some years ago, I started to treat with yellow color.
I remember in 2010 in
Yes,
Lyst.
yes, 2010, it's more than 12 years, yes. Well, it worked. And
at that time you were drawing with a tush, with a color pen,
yes,
directly on the ear.
In the beginning, yes, it was, but it's not very scientific, but it worked.
It worked.
And the other interesting thing is that we have here in the concha of the ear, this is the only place of the body that we have an innervation. This zone is innervated by the vagus nerve or parasympathetic nerve.
Can you please say exactly where is that?
Yes, this is
in the concha.
In the concha, concavity. Yes. Then it's the only place of the body that it's innervated by the vagus nerve.
The 10th cranial nerve.
10th cranial nerve. It's okay. Then we can access to the parasympathetic system in the body. It's the only place. It's wonderful.
And direct.
And direct, you say. Then, if all the people, when they remember something strong, traumatic, they have the body sensation in this region. Maybe here, maybe chest operation, in the stomach. And when you put blue light in the concha, you have a relaxation of all the physical symptoms. And the trauma was delayed. 3 minutes, 5 minutes. It's incredible.
So when you do that, do you fill up the whole concha with light, or do you use the vase to find a specific point?
No, it's not necessary to use the vase. It's not a point. This is in the earlobe, you have the limbic system represented in the antitragus. then you can use yellow color only for the image. And if you have physical sensation, you have to put the blue light on the concha.
So for the image, the thought of a traumatic experience, when you have the image coming to you, you will use the yellow.
Yes.
And for the physical
Symptom,
discomfort in the body,
I use the blue light. You can use both, because you can start with the yellow light for the image, and after that, when the image disappears, you maybe the patients feel something like here in the stomach, in the chest. Well, you can use in the concha. I say in the left side, because if the traumatic image, it's an old souvenir or memory. And in the right side, if it's something new. Okay.
So if it's an old trauma, more than 1-2 years, it's on the left side.
Yes.
And if it's
more than 1 year, it's in the left side.
Okay.
But then, how do you find the region? Because the patient has always some tender zone here. It hurts. Then it's the expression of that the limbic system is activated when you ask the patient to remember the trauma. Then the limbic system in the brain is activated, and you have the representation here, and then you have the tender zone in the earlobe.
Okay, so when you find the area on the earlobe, you press with your fingers to find a sore point.
Before to treat with yellow, if you
remember the trauma?
Yeah, you remember the trauma, you have tender zone here. This zone corresponds to the limbic system, amygdala, hippocampus, hypothalamus. Remember, in Auriculo therapy, we can find the representation.
Okay. So if you have a physical trauma,
yes.
If you have a physical trauma, like you fall on a bike or you get hit by a car or something physical where you have a physical pain.
Yes.
Is there a specific color that you would use for that?
No, because supposing you have an accident with some injuries, the accident is at the same time some physical injury and at the same time it's a psychological thing. Yes. But you remember that in our brain, in the subcortex, we have also the thalamus, that is the organ of the brain for filter the pain.
Yes.
They are together. They go together. It's for that when sometimes, supposing in my cabinet, sometimes who comes to me because he has a low back pain, a chronic low back pain. Yes.
Classic.
Yes, it's classic. Well, if you ask this patient about if you have some memories or some psychological trauma in their childhood, then you will see if you treat the trauma in the childhood, you can after that you have a lower pain, a lower physical pain. Why? Because in the limbic system we have the thalamus, we have the memories. They go together. It's for that.
So when you treat the emotions, the
physical problems?
No, when you treat the psychological problems, the psyche, then you will have a physical improvement.
Yes.
Of any trauma.
Always. You have,
of any physical
before to treat any chronic pain or any functional illness, like supposing the problem in the abdomen or thoracic problem, before to treat this, you have to look for the trauma. Before any treatment, you will find that a lot of patients that never was asked about their life, about their trauma. And people, you will find.
How far back do you go when you go into a trauma? Is it always a childhood trauma, or can it also be an adult trauma from an adult age, or is it?
Yes, supposing this a patient who comes to me because she has a low back pain. Then maybe 3 years before she has lost her husband.
Yeah.
This is a trauma. But maybe in their childhood, in her childhood, she lost her father.
Yeah.
Then you can take two images: the loss of the husband and the loss of her father. If you treat the loss of the father, you at the same time you are treating the loss of her husband. Why? Because in the brain, the loss are in the same file. It's for that. You are treating the file of the memory.
Yes.
And then with this, you treat the low back pain.
So you always treat the earliest memory.
The worst and the early.
The worst and
the
the
worst
early.
and the early. And then you will see the low back pain is lower, and maybe, of course, she has some physical problems, structural problems. Then you can treat with Auriculo therapy, not with color, maybe with needles, and it works.
That's amazing.
Yes,
it
works.
It works. Can I ask about a color? I have noticed that you're starting using the green color.
Yes, it's an observation about this. Why a little stimulation, because a color is a little stimulation, a weak stimulation. Why a weak stimulation has a big response of the central nervous system? Because it's a law called Arnschul's law. It's a biological law.
Again, Arnschul's?
The law is called Arnschul's law.
Okay.
It said that you make a little stimulus, you have a lot strong response.
So small stimuli, big response.
Yes. Then we can prove, it's an observation that I make. If I put the green color, a little green color with a ChromoTerapi in this point, that this is the tragus.
On the tragus, on the O'.
Yes, O' point or the tragus. It's not the point, it's the region, the tragus.
Exactly.
It's represented the corpus callosum. You remember,
yes.
Is the corpus callosum. It connects
the
both
right.
hemispheres.
Yeah,
then,
right and left brain side.
And remember, the green is the color of the balance in the scale of colors. Then you can prove this. You see the asymmetries of the patient, and you put 30 seconds green light here and here, both sides. 1 minute after that, you have the symmetries in posturology, and maybe lower pain.
Yeah.
Yes.
So I have a thing for the jaw. I work a lot with the jaw and the influence of the jaw on the body.
Yeah,
especially
it's an epidemic.
Yes, and yes, it is. So many people have this tensing of the anger, or the sadness,
yes,
or
and
the stress, all these things to hold on to emotion.
How to find the trauma following this sensation. You have to. It's a technique specific for the jaw. You ask to the patient to concentrate and to make the clenching.
Okay.
To make like this, to make the clenching, and remembering
the trauma.
To arrive to the trauma.
Okay.
With the physical sensation, we can arrive to the image.
So if you have a blockage of arriving to a traumatic image, you try and clench the jaw and see if that leads you to the traumatic experience.
It's very easy when you use the physical sensation. Yes, it's more easy because the people want to remember. I think I remember. No, you have to go through the physical sensation. It's the better.
Wow.
Yes. Sometimes you arrive to the trauma, and when you treat it, the jaw is better. Yes.
Amazing.
It's very complex, the problem with the jaw, but first you have to treat the trauma.
Yeah.
To arrive at some solution here.
Yeah. So when you do the posturology thing with the green light on the ears, do you find that it lasts long, or is it a shorter period?
It's not. I don't treat posturology with green.
No.
Because you need a prolongation of the effect. Well, if you use, for example, neurostab, it's a frequency like a color.
Yes.
Then,
yeah.
And it's permanent.
Yes.
The neurostab effect. And for this, if you put the needles, the permanent needles, you have the effect.
Yeah, the ASP needles.
ESP needles,
ASP
yes.
Yes.
I use, for posturology, yes.
Yes.
Or maybe something new that a dentist from Uruguay told me about his experience. He put in the night, he put the neurostab here.
Underneath? On the
in
corner?
the angle.
Yes.
If you see, it's hurt.
Yeah.
Here.
Oh, where it hurts?
Yeah. Here.
Oh, exactly on the corner.
Yes, in the
Okay.
angle, yes.
On the angle here.
If you put this in the angle, you put the neurostab,
Yeah.
it relaxes all this. Then you can call the neurostab in the night here, and the patient is relaxed.
Do you ever use the magnet on the side of the jaw? Have you tried that?
No, I don't.
You don't know that. Okay. Because I wanted to know if you knew if it was the same effect. Well, I have to test that. That's interesting.
That's very interesting.
Well, thank you so much.
Oh, thank you, Rikke.
It's been such a pleasure. Thank you for
it's
taking
for me,
the time.
it's a pleasure also.
Thank you for taking the time.
Thank you.
Thank you.
Thank you, Rikke.
Thank you. Thank you.
It's good.